The following segment on Eyewitness News is sponsored by Living Well.
And welcome to today's edition of Ask the Expert. I'm your host, Shay Paul, and today I have Dr. Jarrett Chapman of Living Well joining us. How are you, Dr. Chapman?
I'm living well and looking good.
You are looking good. No arguments here. Very, very bronzed and sun-kissed.
Yeah, I make the derm squirm out there, but I promise I use sunscreen. I do.
You just have that type of skin. I get it.
I
You can walk to
do.
the mailbox and come back tan. I envy you. I do. But today we're going to have a couple of segments over the next couple of weeks leading up to a very important day, and that is Juvederm Day, which is coming up on Wednesday, August 20th.
That's
Uh,
great.
Today we want to talk about the jawline and jowling, right?
Yeah. Yeah.
Okay.
So the Juvederm portfolio, which is a collection of hyaluronic acid fillers, is the most used and sought after hyaluronic acid filler in the world. So it is the top line of the products for many reasons, but one main reason is that the engineering of these gels is specifically targeted to the tissue that they're placed in to produce the desired result. There is no other product line on the market that can truly say all of those things about their products. So that's why we use Juvederm portfolio exclusively here at Living Well. But one of the things that we get most asked about is what can I do about the jowling? And, this was an explosion back in the days of COVID when we were all on Zoom calls and people were
Right.
looking at themselves and they could see the jawline starting to
Yeah.
descend. And it became one of the number one searches on Google search to try to figure out what can I do to tighten my jawline. And so there is actually a hyaluronic acid filler made by Allergan, which is Juvederm Deluxe
Okay.
XC. It is a very robust, cohesive filler that is made for only the jawline and the lower chin. And it does an absolute beautiful job in giving us definition through here and lifting this tissue along with voluma in the midface. So when patients come in and they're talking about jawline and what can they do to sharpen their jawline, the first thing I do is look at their midface volume and let's make sure we get that balanced properly. Make sure that the lift that we can get laterally with voluma, like we talked about last week,
Right.
is achieved. And then we move to that jawline and we use Velux in this jawline to really, really give definition. You don't have to use a lot of Velux. When it first came out, there was a lot of hype around it and, talking about large amounts of this filler to create these jawlines. And here at Living Well, we really developed a technique where 1 to 2 syringes in the jawline for females, maybe 3 to 4 syringes in the jawline for males, because they like a more defined jawline.
Right. Right.
Is
It makes
what's
sense.
maximally needed to use this product. This product lasts greater than a year, according to the FDA's indication. It is, again, indicated only for the jawline, and it specifically treats that jowling, chin projection, and also lift through the superior ramus, which is the area just anterior to the ear, or what we call the pre-auricular area. When
Okay.
used in these areas, you get a natural looking jawline that looks absolutely beautiful, and the patient looks more youthful. Again, things can be overdone. And when you look out there and you look around, I don't want my patients or the audience that's listening to us to be scared of filler. There's a lot of things you have to look at. And I always say to get the perfect result, you have to have there's 3 P's that are involved. There's product, there's placement, and there's actually the proficiency of the injector. And when you get all 3 of those things to line up, you get the perfect outcome. And so that's what you should look for if you're out there considering filler hyaluronic acid gels to kind of ease and soften the aging process. And I think you'll get a great outcome. But Velux, Juvederm Deluxe XC is my favorite product. it absolutely does an amazing job. Of course, I say they're all my favorite products. I love
You do. I
Voluma.
was
I
thinking
do.
that. I wasn't gonna say it.
Voluma is just like the magic in a syringe, I'm telling you. But Velux adds to it. It really will reduce that jowling, make the chin balance with the lips and the nose. And again, that's another thing. It's all about balance. It's all about being able to
Symmetry.
look at a patient's face and analyze the features and see how they're balanced with each other and keep that balance in check. A lot of times patients come in, they want lips and they don't need lips. What they need is a chin. And they don't realize that because no one talks to them. They just stick lips in them and send them on their way. And then you have Mrs. Potato Heads walking around. You got big lips stuck on a flat surface, and it's not the most natural look. So
Yeah, I've seen it. Yeah.
yeah, we've all seen it, and then it scares people, and they don't want to have their lips done. They don't want to have anything done, and it's all
Yeah.
about balance. And hyaluronic acid gels are amazing, and they're even more amazing in the right hands.
Awesome. Well, great information. And we're looking forward to when you come back next week. We're going to talk about how it can be used effectively in the temple area.
That's correct.
All right. Thank you so much for being with us, Dr. Chapman.
Thank you, Shay.